COVID-19 lockdown in India. Impact on the poor and the government's response. On 24th March 2020, the Indian government announced a sudden 21-day nationwide lockdown owing to the COVID-19 pandemic. The lockdown, which was extended to 68 days, imposed the shutdown of all commercials, industrial and transport activity. Since then, various state governments have imposed curfews and lockdown in areas experiencing a spike in the number of reported COVID-19 cases. India was particularly vulnerable in a lockdown for three reasons. First, it has a large proportion of households that rely on casual employment, low median household savings that are inadequate, the large proportion of Indian families in poverty into a high degree of financial insecurity, and vulnerability to shocks. India is the second most affected country by the pandemic globally. As of 8 May 2021, India has had more than 22.3 million reported cases and at least 242,000 recorded deaths. However, it is believed that due to vast underreporting, the ground reality is far worse than what the official figures shows. At a time when India is looking to ramp up its vaccination program to combat the spread of the virus with its two locally produced vaccines, the country is in the midst of a severe second wave that is putting an immense pressure on the health infrastructure. The government over the past 1 year has taken steps to improve national health. In a budget speech in February 2021, Finance Minister Nirmala Sitharaman announced a 134% increase in the allocation for health. However, this increase has been across departments and not just the Ministry of Health and Family Welfare, which is the primary government vehicle to provide equitable, affordable, and quality primary health care. The pandemic could also have long lasting effects on the health of Indian citizens through nutrition. Good nutrition is especially important for a demographically young and growing country like India, since malnutrition has long term consequences, especially in children whose lifelong physical and cognitive development is irremediably affected by their nutritional status during the early stages of their lives. Large proportion of the Indian population was affected by the 68-day lockdown. Importantly, the lockdown disproportionately affected communities that are economically and socially marginalized. To revive economic and health, the government has introduced a range of programs since 2020 and announced new initiative in the 2021 budget. All the best, students. Please like and subscribe to my channel Pearl Tutorials.